So for today, I'm very excited to introduce to our guest, which is Prof. Madya, Dr. Ramliza Ramli.
Hello.
Yep. Okay, so I'd like to give a small introduction about you before starting with the questionnaire.
Okay.
So Dr. Ramliza is a consultant, clinical microbiologist in Hospital Canselor Tuanku Muhriz UKM, or HCTM in short, and a medical lecturer in the Department of Medical Microbiology and Immunology, Faculty of Medicine, Universiti Kebangsaan, Malaysia. With over 17 years of experience, she has dedicated her career to antimicrobial stewardship, antibiotic resistance, and diagnostic bacteriology, all crucial areas in fighting infectious diseases. I believe Dr. was also aware of the COVID-19. Doctor was a part of the COVID-19 crew as well.
Yeah.
So she started out as a lecturer in the clinical microbiologist, making important contribution to the field of microbiology in Malaysia. To further specialize, she trained in Taiwan in 2011 and Singapore in 2017, gaining advanced knowledge in antimicrobial stewardship, the practice of using antibiotics wisely to prevent resistance. She is also an internal auditor for the Malaysian Society of Infectious Disease and Chemotherapy, in short it's MCIDC, helping to maintain high standards in infection control. The research focuses on three key areas, which are antimicrobial resistance, studying how bacteria becomes resistant to antibiotics, and finding ways to stop it. The second one is the antimicrobial stewardship, encouraging responsible use of antibiotics to ensure they remain effective. And third is diagnostic bacteriology, improving method for detecting bacterial infection to help doctors make faster and more accurate diagnosis. So Dr. Ramliza earned her Doctor of Medicine, MD, from Universiti Science Malaysia. As you can see, that was earlier the same Universiti Science Malaysia.
Yeah.
Yep. In 1996, then pursued her passion for microbiology, completing her Masters of Pathology, MPath, from UKM in 2005. That was the year that we were born, actually. Her work has made a big impact in tackling infectious diseases and antibiotic resistance, benefiting both patient and the healthcare system. Today, we are excited to talk with Dr. Ramliza about her journey, what led her to choose microbiology after earning her MD, and the experience that shaped her career. We'll also get her thoughts on the challenges in antimicrobial resistance and diagnostic bacteriology today. So let's give a warm welcome to Prof. Madya, Dr. Ramliza.
Thank you.
So we'll start with the questionnaire. So this first questionnaire is about the doctor's background.
Yeah.
Okay, so for the first question, Prof, what initially inspired you to pursue a career in medicine? And what led you to specialize in medical microbiology after earning your MD?
Okay. Before I start, I would give all my credits to my teacher. Okay. I attend my primary education in Sekolah Rendah Kebangsaan Perempuan Jalan Yahya Awal, Johor Bahru. Okay, and then I go to secondary education in Sekolah Menengah Sains Muar, and then at my time we have to do PERU, that takes 2 years. 2 years. It's not 1 year. Yeah, so it's 2 years. And that's the point when I start to think what I should be. And then I have a passion to be a teacher, but my mother doesn't encourage me to be a teacher. She said, you have a good academic achievement, so why don't you think of something better than that? So at that time, the popular course that being chosen are medicine, law, dentistry, pharmacy. So I decided to study hard to make sure I can qualify to be selected, and attended the interview as a medical student, and I was selected. Yeah. I have no one in the family with medical background, so we don't have anybody to aspire us for that, but I just move forward and try to be a better person. So I choose medicine, then I studied in USM, for 5 years, okay, and then graduated, and then I do internship. That time only 1 year, so we do medical posting, orthopedic posting, and obstetric and gynecology posting. So that took 1 year. Okay, after completion, then I am being posted. I was posted to Hospital Batu Pahat. Okay, Hospital Batu Pahat, and there I was assigned to medical department. Yeah, and it's a district hospital with a specialist. But I also have to take care of psychiatric patients and dermatologist patient. That one, I work with visiting consultant psychiatrists from Hospital Permai who come regularly, and also visiting dermatologists from Hospital Muar. So that was my initial clinical experience after I graduated as a medical student. Then I was transferred, I moved to Hospital Kuala Lumpur, and then I was posted to anesthesiology and intensive care department. So being in anesthesiology and intensive care, I worked for 1 year. Then after 5 years experience as a medical officer, then I start to think about my career development. I have the interest in microbiology since medical student, but that doesn't trigger me to be a clinical microbiologist. I am more inclined to the clinical posting, but at a certain point when I didn't get the chance to test my interest in clinical microbiology, even though I like the topic, Yeah, then I went and see the hospital pengarah, the director, and told him that I want to take masters in pathology, but I have no experience. So can you send me to the department so that because I fill in the form, I want to do masters pathology. I said, yeah. Then I get the chance to expose myself to the laboratory medicine, and from there I continue until today.
Yeah, that's a wonderful insight. that was a wonderful story. For the next question, I would like to ask, what are the 3 major differences between practicing as a medical doctor and working in microbiology? And how did you adjust the transition from one to another?
Oh, okay. So the key major difference is that you don't see patient. You don't see patient directly, but we deal with clinical specimen. So that's the key difference. We don't have patients with us, but we see the clinical cases coming every day to the lab through the clinical specimen sent to us.
So the patient became a small organisms, microorganisms.
Yeah, and we deal with the clinical specimen, produce report, lab report, and we liaise with the clinician about the patient. Yeah, so that is the difference.
Would you recommend MD graduates to consider microbiology as a career pathway?
Oh, okay. I would recommend to MD student to explore clinical microbiology as your career pathway. Yeah, it is an interesting field, and it's a different field. It's not a typical field being a clinician where you see patient, and you have lots of opportunity to grow and advance your career in clinical microbiology. As you can see what we have had here, so lots of opportunities.
Yes, it's very nice to see all of these opportunities right in front of us. So going to the next question, Doctor. for aspiring doctors in Malaysia who are interested in microbiology, what are the available qualifications and pathway to enter this field?
Okay, to enter this field, you currently in Malaysia, you have to have clinical experience, adequate clinical experience, and have experience in the lab, working in pathology. And then you have to sit for the exam, entrance exam, and if you pass the entrance exam, then you can apply for to pursue your study in master's pathology, specializing in microbiology. Yeah.
So the career pathway for doctor and us is still the same, I believe.
Yeah.
So the way is still there. So okay, so this is also a follow-up question for just now. Are there any specific skills or knowledge areas that a student should focus on?
For specific
areas for students to focus on to pursue this microbiology.
Okay. Being a medical student, for now your aim is to pass your medical degree. So the focus is on all topics, all learning objective in medical degree. Okay. Then you go to work, you do the clinical work. To the area that you should focus would be on infectious diseases. Yeah.
So this is also another interesting question. What are the career opportunities after specializing in microbiology?
Okay, after you specialize in microbiology, you don't work in the ward. Okay, so you have option to work in the university as a lecturer. But being in a university setting, you have also hospital services. So you will work in the Department of Diagnostic Laboratory, diagnostic services. Okay, and then another option, you can work as a clinical microbiologist in the Ministry of Health. So you can work in the hospital, ministry, government hospital as clinical microbiologist, or you can also work in private hospital and manage private laboratories. And then after you qualified as clinical microbiologist, you can choose whether you want to further focus on bacteriology, virology, mycology, parasitology.
So all the subspaces, sub areas.
Yes, and also in infection control. Yeah, so you can opt which one you want as your niche area. Like for me, I am in bacteriology, so I deal with bacteria. Yeah.
So that shows on the antibiotics.
That's how I end up with antimicrobial stewardship and also in the antimicrobial resistance committee at hospital and also at national level.
Especially the next session, which is professional insights. So how do Malaysia see? How do you see Malaysians' approach to antimicrobial resistance evolving?
Malaysian approach, it involves all stakeholders, because antibiotic is not only used by human. Antibiotic is also used in the livestock industry. It's also for human, we use in the hospital and also in outpatient setting. So for human side, all these body or hospitals, healthcare setting must understand about the importance of controlling antibiotic use and in order to delay the onset of resistance. So that one is human side. And then we also have animal side. They use antibiotic For human, when we use antibiotic, the antibiotic that we use is to treat infection. Okay, and we use it at small doses. But in livestock industry, in agriculture, they put the antibiotic in the animal feed. You know, because animal as a growth promoter and also as part of their daily staple. Okay. So because we can sense that when the animal they are sick, they cannot tell, and they live in a crowded environment. So when there is an outbreak, the whole group
population
of animal can be affected. So they put the antibiotic is added to their animal feed, you know, and that may explain why you can identify resistant organism from the gut that can be passed on to human. For antimicrobial resistance, we have to sit together with the animal industry so that they can understand how the antibiotic can result in resistance. Because to our surprise, they also buy antibiotic online. They order and they can buy in big volume. When we talk about medical ethics, it's about human. Okay. So that is the prior practices. So we have to create awareness to them that improper use of antibiotic in livestock industry can also result in antimicrobial resistance.
So the third session is challenges and growth.
Okay.
So for the first question, Professor, what are some of the challenges you have faced throughout your career, and how do you overcome those challenges?
The biggest challenge is time. Yeah, time and multitasking. Because we have to balance ourselves with teaching commitment and also hospital service commitment, and both must be met within the timeline. Yeah, so during exam season, so then we will be focused more on academic work, attending, and during teaching season, also our time is there. But if we have to balance ourselves, because for the clinical service, at any time the clinician might contact me for any laboratory report that have issues. So these are the challenges, but I don't think it's a big challenge. It's a normal challenge.
Basically, work-life balance.
Yeah, work-life balance.
Okay, so for the next question, Professor, could you share a little about your experience when you were training in Taiwan and Singapore for your antimicrobial stewardship?
Okay, my experience when I went there at that time, there are 4 people from Malaysia going, and at that time we are not well versed about antimicrobial stewardship. We know about antibiotic resistance, but stewardship is a different thing. Yeah. So when I went there, I went to Taiwan. The antimicrobial stewardship program is very established there. In fact, it is the excellence center for antimicrobial stewardship. Taiwan has one excellence center for antimicrobial stewardship. Yeah. So then I see that to curb antimicrobial resistance, we cannot work in silo. So we have to work the clinical microbiologists with the infectious disease physicians, other clinicians, and then the pharmacists, and also the information technology expert have to work together. Because we are using data, laboratory data, to promote antibiotic use and to control antibiotic use. So information technology is another important aspect that must work together, that should work together for antimicrobial stewardship. That was in Taiwan. And then in Singapore, I have to attend a training in antimicrobial stewardship, where we have to work in groups, do presentation. There we have lots of scenario given in a hospital setting, and then we have outbreak of Clostridium difficile infection, or CDI, Clostridium difficile infection. There's an outbreak and involve multiple patients in the ward. So how are we going to tackle the problem? It's more of imparting new knowledge on how to work with other healthcare personnel to make sure that we have reliable treatment protocol for the patient, antibiotic protocol. That the one that you have there on the wall is the antibiotic protocol for medical ward. That one is based on our local data in the hospital. We have a national antibiotic guideline. That one is for national use. But each hospital have their own resistant pattern. So we have to revise, we have to formulate our own antibiotic guideline in our hospital. And we can also compare with the national guideline whether it is same or not. If it is not same, mean that in our particular hospital, there are some area of resistance that we are dealing with, and then we need to tackle the issues.
And I believe like certain hospitals, like you have a certain areas of people coming, and that maybe certain area might have the resistance to maybe an antibiotic.
Yeah, different hospital have different patients.
Yes,
Patient epidemiology is different. If in a district hospital, most of the infection that come is a community-acquired infection.
Yes,
And community-acquired infection, the bacteria are not very resistant, they are susceptible. So for that hospital, their treatment guideline will be different.
Yes.
But in a tertiary hospital, a hospital which take lots of referral cases from all over Malaysia, we have complicated cases. We have patients with long hospital stay, multiple admission. So if they have infection, the bacteria that will be isolated are usually resistant bacteria. So we cannot use the first line antibiotic, the typical antibiotic in community setting for this patient. So that's why the antibiotic protocol for each hospital might be different. And where does this protocol come from? It comes from the lab report.
Yep. That is supposed to be.
So we have to train the clinician on how to send the correct specimen. Because if they don't send the best specimen for that infection, as for example, patient has pneumonia, we send sputum. And then when you send sputum, it must be sputum, not saliva.
Yes.
If it is saliva, then what's going will be the normal flora. Okay? And then likewise for bacterial culture, it must be sent. The blood must be taken aseptically. If the junior doctors don't do it aseptically, what you will get are all normal flora. And then how to interpret the lab result. If patient have catheter, intravascular catheter, then we have trouble. Is it a significant pathogen, or is it a colonizer, or is it a contaminant? No. So education to the clinician, to junior doctors is also important as part of antimicrobial stewardship program.
Understood. That explains the question. Okay, so workshop or training programs do you regularly attend to stay updated in the rapidly evolving field of microbiology?
Okay, the one that I annually attend is CLSI antibiotic susceptibility update. Actually, every year when we talk about antibiotic resistance, each bacteria has a set of antibiotic that need to be tested. One bacteria have specific antibiotic panel to be tested, and then this antibiotic will be interpreted as susceptible, resistant, or intermediate. So the CLSI will update the value for interpretation every year. So we have to attend and review our antibiotic, our lab protocol every year because the diameter will change, may change.
Yes, sir.
It's being reviewed every year. So this is one of the tests, the course that I regularly attend. And besides that, the regular courses like antimicrobial resistance awareness, antibiotic awareness courses, awareness program. Sometimes I attend as participant, sometimes I attend as a panelist or as speaker. Yeah.
That's one of the last question, Doctor. Yeah, so before we end our session, do you have any advice to our fellow medical students, Professor?
Okay, my advice will be for the student is to really focus in your study, set strategy to study smartly. Do not neglect your learning guide, student learning guide.
Yes.
You have the student guide,
Yes,
kan?
Professor.
Okay, in there all the objectives are being listed. Make sure you cover adequately, and then use the correct references. Okay, don't Google all the time. I know it's easy to get all the information, but the content when you take online is sometimes is not appropriate for your learning output or outcome.
Yes, Professor.
And then you spend lots of time finding information in the internet, whereas your textbook has a concise, it's very concise, all the relevant information is there. So you will save lots of time if you read the correct references.
Yes, Professor. That explains it.
And it also helps you to limit your breadth and depth of learning. If you go to internet, you Google everything, you are dealing with research papers. And these research papers are not the things that are available in your textbook set for medical students.
Yes, Professor.
So you will have unnecessary stress, unnecessary wastage of time. So you don't have enough time to enjoy your life as a medical student because you read the wrong material.
Yes, Professor.
So I think for medical students, this is one of the advice that I would like to give to you, because when I take PBL also, I notice that students learning issues sometimes they take from internet and they don't even read what are the references that being provided for them.
Yes.
They don't use the right textbook or right learning resources to learn and to be a medical student.
True.
So that is one of my advice. Besides that, you must also have study and life balance. You can only achieve balance if you know how to manage your learning materials and also your time. And be in the right circle.
Yes, Professor. Okay, Professor. So we would like to extend our heartfelt gratitude to Professor Madya Dr. Ramliza for graciously taking the time to join us for this interview. It was truly a pleasure, and to hear invaluable insight of yours and a lot of experiences as well. So her wisdom and passion have been both inspiring and enlightening. We sincerely wish her continued success in all her future endeavors. Thank you so much, Professor.
Thank you.